Today I'm going to show you how to extubate a patient. So the first thing I'll do is receive and confirm orders for extubation. I'll communicate with my nurse that I'm going to do the extubation, and then I'll go to my patient's room. I'll assess him, introduce myself. Mr. Jones, hi, I'm Lauren from respiratory. I'm going to take your tube out today and extubate you. And then I'm going to kind of evaluate his general appearance, see how he's doing, and listen to him, see if he needs to be suctioned first. And he does need to be suctioned. So some of the things I have with me today to suction him are his catheter. So this is his inline catheter, a Yankar, a syringe, bag mask just in case, and then I have his O2 already hooked up. So then I'm going to put him in semi-Fowler's or high Fowler's position. I'm going to tell him what I'm going to do. Mr. Jones, I'm going to suction you before I extubate you. So I'm going to go ahead and go down with the suction catheter. Then I'm going to suction around his mouth, get all the extra secretions out, make sure he's all clean. I'm going to put a towel under here so when we take the tube out, nothing gets all over him. Then I am going to deflate his cuff. I'm going to listen and see if there's air movement around his cuff. And there is, so I'm going to go ahead and reinflate it. That means that we are going to extubate today. The next thing I'm going to do is take off his tube holder. Then I'm going to deflate the cuff. Alright, I'm going to take your tube out, Mr. Jones. So I'll take his tube out. And then I have my O2 already set up. I'm going to put my nasal cannula on him so he's got his oxygen right away. Then I'm going to suction around his mouth. Make sure I get all those extra secretions out. I'm going to assess him for laryngospasm, edema, any other side effects of having a tube in there. Going to listen to him, listen to his lungs, see how he's doing. Then I'll listen to his neck and his trachea. Make sure there's no stridor and he sounds good. I'm going to check his vitals, make sure he's doing okay. Then I will go to my nurse, make sure I document the time of extubation, report how he tolerated the extubation, and document how everything went.